your fingers, then under your nails, and then when you turn off the sink, you want to, if you have something in your hand, you want to use that to turn it off and also to open the door to leave so that you're not touching something that you touched before your hands were washed. All right. What other questions do people have about hand washing with either soap and water or hand sanitizer? Okay. Now I'm going to talk a little bit about how to use a mask, and I'm sorry because I don't have a picture right now. So masks, the point of a mask is to keep your droplets inside you. So right now, if you were talking and you put your hand about 2 inches from your mouth or your nose, you would feel this warm moisture. And in that warm moisture, there's droplets. And that's how we think coronavirus is spread. And so by wearing a mask, especially if you're sick, what you're doing is you're keeping most of those droplets near your face instead of spreading into the air where they can travel to other people. And so a mask is only going to work if you wear it correctly. And to wear it correctly, you need to cover your nose and your mouth. I've seen a lot of people wearing masks that only cover their mouths, and that doesn't work because there's droplets coming out your nose. So what you want to do with the mask is put it on so that it's over your nose and over your mouth. And at the top of the mask, there's often sort of like a wire, and you want to bend that wire so that it fits really snugly over your nose. The goal is that it's helping any droplets from getting out. Are there any questions about masks?
Yes, this is Fernando and I do have a question.
Go ahead.
So when you're sick and you're coughing a lot, and for each time period, how long are you supposed to change your mask?
That's a good question. So if you're coughing a lot, there will be a point at which your mask gets a little bit wet from all the coughing. And certainly if you can feel any wetness on the outside, that's time to change your mask. Oh, I also want to share, there are what we call surgical masks, which are the ones that are more loose fitting. And then there's the N95 ones that look like ovals. And it's confusing which is the most necessary. Right now in the hospital, everyone is wearing the looser ones unless they're doing a procedure, like providing asthma medications to a sick patient or swabbing them. In the hospital, we're having shortages of the N95s. And so because of that, we're asking that families don't run out and buy N95s, that they use the surgical ones, because they're usually not doing those aerosolizing procedures. All right, so a couple final thoughts, and then I'm going to move into the questions that people sent me. So don't panic right now. You don't need to panic, but you do need to be serious. It's important to wash your hands frequently and correctly. Oh, I don't know why all the blue scribbles are coming. If you have long nails, please cut them. Wear a mask if you or someone you're with is sick, and practice social distancing. Social distancing is going to save lives. Please practice it. Please help the people that you know practice it. I'm going to pause for questions, and then I'm going to answer the questions that people submitted by Google Documents or by the Google survey.
Hey, Dr. Frank, it's Miss Solomon.
Hi, Miss Solomon. What's your question?
My question is, if you don't have symptoms, should you be wearing a mask in case you're asymptomatic, or should you just not worry about it until you have symptoms?
The truest answer is we don't know. Um, I if I recommend that if you're going to the grocery store, um, or if you're in contact with someone outside of your house for whatever reason, whether it's bank or pharmacy, I would recommend wearing a mask. I think if you're in your own home and you don't have symptoms, like you've already been exposed anyway, and so it's okay to not wear a mask.
Got it. Thank you so much.
What other questions?
Hi, Dr. Frank. This is Miss Chan.
Hi, Miss Chan. What questions do you have?
What would be like the first sign, like if you're asymptomatic, and or what would be the first sign that you perhaps may have this virus?
It varies. For adults, it's usually dry cough. It can be body aches. It can be fever. Um, for kids, it can be the same, but also we're seeing more often in kids runny nose and sore throat.
Thank you.
Dr. Frank, can you see the chat? I see that there's some questions there from Walter.
Oh, let me look. I can't see it. Can you read them out loud and I'll answer them?
Sure. So Walter is wondering, do dogs get coronavirus and get sick?
That's a great question. We don't know yet. But one of the risks with dogs is if other people pet your dog, that can put people at risk. So this is a time to not pet other people's dogs, only pet your own dog. And I think there's been a question of whether or not animals can get it. We know this came, or we think this came from bats, but we don't know yet if animals are getting it.
Thanks. And then his other questions are about Guatemala. So he said, is the coronavirus in Guatemala? Do all people get sick by coronavirus in Guatemala? And what can his parents tell their family about, what should they tell their family in Guatemala about the virus?
Those are great questions. Let me look up real quickly how many cases there are in Guatemala right now. But in terms of what to tell their family, please share all the things that we just talked about. So if available, they should get soap. If available, they should get a couple masks, but not tons and tons of masks, because then there won't be any at the hospitals. To practice hand washing, to stay home if sick, are very, very important things. There is, for everyone to know, if you search Johns, Johns, Hopkins coronavirus tracker, there is a global map where you can see the number of cases, and they update it a few times a day. Number of corona cases, Guatemala. So that's what I'm searching, and you can search the exact same thing on your own if you're curious, because it's going to keep changing. And I'm not seeing numbers immediately pop up, and I'm not seeing the Johns Hopkins website refresh right now. A couple times a day they do maintenance, and I suspect that's what's happening right now. But that's something you can check later today to figure out how many cases in Guatemala. I do believe there have been cases. I don't believe that the outbreak has been as bad as the United States at this point. Okay, I'm looking at some of the questions that had been sent to me. One question was, what was the recovery rate for the coronavirus? And we think about 80%. Well, what we think is 96.4%. So the vast majority of people who get coronavirus will recover. So as I talked about 20% might need to recover in the hospital, but of those who are hospitalized, most of them will recover. It's a small percent that doesn't recover, but it is this disease is more deadly than the flu. Has this stopped work on other diseases? It slowed down work on other diseases because right now scientists are working very quickly to try to understand how does this virus work, what medicines either exist or could we create that will treat this virus, and trying to create a vaccine for it. So resources have definitely been shifted temporarily to work on this as quickly as we can. Someone asked, how do I know if I have coronavirus? And that's a really good question. And the way to absolutely know is by getting a test. But more importantly, if you have any of the symptoms we talked about, you should assume that you have it and act like you have it. And by that, I mean taking lots and lots of measures to wash your hands, cover your mouth, stay away from elderly people, and stay in your home. Do you stay with the virus or does it go away? We think it goes away. One thing we don't know is if you can get it more than once. And we just don't yet have enough information about that. One student asked, how did it spread so fast? So the reason it spread so fast, there's a couple reasons. One is a lot of people who have it didn't know that they had it, and so they were in regular contact with other people. One is this virus can survive for quite some time in droplets and on surfaces. And so because of that, and because we sort of didn't realize how serious it was and we kept interacting with each other, that's how it spread so fast. Is the coronavirus that bad that you can't go outside yet? So yes and no. So you can go outside your house. It is fine for you to stand outside your home and breathe fresh air. That's completely okay. But it is bad enough that we don't want people being outside close to each other. We want people spread apart. Is it in California? Yes. There are about, probably as of today, we'll have 600 cases in California. Many of these are in the Bay Area. Alameda County, I think last I saw, had 27 confirmed cases, but there's likely lots more cases that that just haven't been tested. And the test doesn't have to be done. We just need to be smart in acting as if we're positive if we have symptoms so that we're protecting other people. Does coronavirus have RNA or DNA? I'm very proud that an 8th grader asked that question because that tells me you remembered viral structure from 7th grade. The coronavirus has RNA. I don't know how zinc ionophores work, and immunocompromised people are especially at risk.